So today's topic will be on hepatitis B infection. It is a very important topic in respect to undergraduation as well as post-graduation. A clear understanding of the topic is very essential for our day-to-day practice. It is not only a theory topic, but this situation in which a patient is hepatitis B positive, you will be encountering day-to-day practice. Okay. So today we'll be reading about hepatitis B virus as such. But before that, we'll just see what are the other viruses that can cause hepatitis infection. Okay. So the common ones are hepatitis A, B, C, D and E. Whereas the less common ones are cytomegalovirus, Epstein-Barr virus and rarely even yellow fever, hepatitis G, herpes simplex virus and hepatitis TT viruses. These can cause hepatitis. So there are certain exotic viruses like, as we know, Ebola virus, Lassa virus, Marburg virus. These all can cause hepatitis. So the common ones are A, B, C, D and E, and the less common ones cytomegalo, Epstein-Barr viruses, and you can remember herpes simplex and hepatitis TT and yellow viruses can cause viral hepatitis. So chronic viral hepatitis, the burden of hepatitis comes mostly from the chronic viral hepatitis. So that is why we'll be dealing that in detail. Anyway, hepatitis A and E, they do not have chronic forms. So both are enterically transmitted, which means fecal-oral route, and they are very much self-limiting and they do not cause any chronic hepatitis. Whereas hepatitis B plus D and hepatitis C, all this causes chronic infections. So these are the things that we'll be covering today. Brief history, structure on viral proteins, what is a precore mutation and what is an escape mutation. We'll be dealing a little bit about the pathogenesis and clinical manifestations and treatment of hepatitis B. So, the brief history. So, this person here is Barish Blumberg. Okay. So, he was the one in 1950s to 1960s, he had gone and collected blood samples from a lot of patients from all over the world and he wanted to know why certain diseases affect certain population. So, when he was doing that, he collected blood from a group where repeated blood transfusions were done. The group were thalassemia group. So those patients had certain antigen in their blood, which he named it as an Australian antigen, which was later discovered to be HBsAg. So this is how it all started. Okay. And so 400 million people have chronic hepatitis B with a varying prevalence. And whereas the likelihood of getting an acute hepatitis going to a chronic state, it varies with age. Actually, the younger the person has acute hepatitis, the more the propensity for the person to go in chronic state. So that is why for vertical transmission, that is the transmission which occurs from mother to child, directly they go into a chronic hepatitis state without entering an acute hepatitis state. So what do we know about this HBV, that is hepatitis B? So it is a partially double-stranded DNA virus. So I'll just show you the structure of it. This is the structure of the virus. So it is a partially double-stranded DNA virus. It has a positive strand and a negative strand. So we should remember that the positive strand is an incomplete strand and a negative strand is a complete strand. And positive strand is attached with a primer and the negative strand has a polymerase enzyme attached to it. Okay. So there are 10 genotypes of it. We need not know the names. The most common one is type A. Okay. And let's see. This is a Dane particle. This Dane particle is 42 nanometers and these small filaments and spherical structures are 22 nanometers. The 22 nanometer particles are non-infective, whereas this 42 nanometer particles are the infective ones. I hope it is clear. So infective viral particle is 42 nanometer, which is a Dane particle. And a non-infective is 22 nanometer sphere and filaments. This is the introduction which you need to know about viruses, about hepatitis B virus. So it is a DNA virus and it has 10 genotypes, among which the common is type A, and type C has more propensity to develop a hepatitis C co-infection, and infective viral particle is 42 nanometer and 22 nanometer is a non-infective particle. Okay. So this is an open reading frame. So this is the gene of hepatitis B. So how are we going to read this? So let's come from outside. First is S gene. So this S gene codes for HBsAg. This has 3 parts, pre-S1, pre-S2, S, which is not very important. Just know that the first gene, which is S gene, it is an open reading frame, codes for HBsAg. Now, where is the second gene now? The second gene is C gene. So this C gene codes for core antigen, which is HBC. This is the core antigen and this is the pre-core antigen. So this area is important when we read about pre-core mutations. So what happens to pre-core mutations? All those things we can read. So this area codes for HBE antigen, HBE, and this area codes for HBC antigen. So HBE, as we will be dealing later, it was HBE antigen in a HBsAg indicates infectivity of the virus. Okay. Now this P gene, this gene codes for reverse transcriptase enzyme. So P gene codes for reverse transcriptase enzyme, and X gene is generally the role is unknown. So some carcinogenesis it is implicated, but generally the role is unknown. So these are the 4 genes. So first is S, C, P and X gene. So in acute hepatitis B infection, so after a percutaneous exposure, we have 5 to 30% chances of contracting a hepatitis B infection, which is 1000 times more of HIV and 100 times more of HCV infection. So getting a hepatitis B infection is far more common than getting a HIV infection after a prick. So in blood transfusions, especially after the screening, 1 in 2 lakh population only we get it. We also get it through IV drug abuse, IV drug route, sexual mode and very minimal via breast milk. So that is why even if the mother is HBsAg positive, we advise patient to give breast milk to the child. So incubation period is 60 days. So around 2 months is the incubation period. After the incubation period, the symptoms starts. Usually first fever comes followed by malaise and vomiting, which is usually followed by jaundice.